everyone, welcome to Dr. Kim's Dental Radiology YouTube channel. In today's video, I would like to go over palatal exstosis in CBCT. First of all, based on my experience, exstosis tend to occur more along the buccal cortical outline of the maxilla or mandible. So that's more common. However, every once in a while, I do see exstosis along the palatal cortical plates of the maxilla, and that's what we have today. So to best demonstrate that, I'm going to show you, first of all, through the axial view of the CBCT scan. So as I go up and down of this maxillary arch, where do you see the thickening of the palatal cortical plate? As I have already conveniently placed my crosshairs, you can see that there is a thickening of the cortical outline in the area of tooth number 2 and number 3. Additionally, another thickening occurring on the contralateral side associated with tooth number 14. So let's take a look at that one more time. Here's the crown, moving toward the apices of teeth. There you go. So let's take a look at that in other views. So let's check out our coronal section. So yes, there's substantial thickening of the cortical bone and also almost an exophytic growth of the bone, doesn't it? Additionally, please note how thin the soft tissue layer is overlying this bony structure. Whereas if you go toward the base of the alveolar process, soft tissue is much thicker, whereas it becomes markedly thin over this area. Therefore, if you're taking an alginate impression or any sort of an impression of the maxillary arch, it is important to avoid the tray running into this soft tissue, as it can cause a lot of pain and discomfort for the patient. From this coronal view, we also see that there is another exophytic kind of growth of the bone along the hard palate, or you can say the floor of the nasal cavity, which is consistent with maxillary torus, right? So we have maxillary torus as well as palatal exstosis. And really, if you take this part out and compare to this part of the maxillary torus, they look exactly identical. And what happens if we find this along the lingual cortical plate of the mandible? Well, we call them mandibular tori, right? So there you go. So let's see if we can visualize that in the sagittal view. So this dense bony area corresponds to the exstosis. And let's go to the contralateral side. Right here, again, corresponds to the exstosis. So now the question is, can we take a look at this in the 3D rendering? I think we can. I do see that number 2 and 3 side is bigger than this side. So let's take a look at the lingual of number 2 and 3. So right here, yes, we can visualize exstosis, and also on the other side, excuse me, can be visualized as well, right? So that's great. So now we happen to have a periapical radiograph of this area. So let's take a look whether we can tell just based on two-dimensional like periapical radiographs. So here's the periapical area of that same patient taken a few weeks prior to that CBCT. From that CBCT, this tooth number 4 was missing, but you can still see the root tip of number 4. But I want you to pay close attention to this number 2 and 3. Based on this radiograph alone, would you have known that there is a palatal exstosis? I don't think we can say that, right? I really wouldn't have known that unless I checked the patient in the mouth. So we can't really definitively tell that. Let's see if I have another periapical area of that tooth, and yes, we do. Again, can we tell there's exstosis? No, we cannot, right? So yes, exstosis, depending on its size and how dense it is, you may or may not be able to tell. But in this particular case, we cannot visualize palatal exstosis based just on two-dimensional periapical radiograph. So again, thank you very much for your attention. I hope you found this video helpful. If so, please hit the like button and be sure to subscribe my channel as I continue to upload my videos on a regular basis. And until next time, take care, and I'll see you in the next video. Thank you.